I chose this field based on just immediate attraction. To me, holding a drill and entering the middle ear is the most beautiful thing you can ever do.
I like the balance between having a relationship with your patients, but also being able to do surgery.
The satisfaction you get from seeing a patient after you've solved their problems is an undescribable feeling.
I'm Andrea Van Butis. I'm the chair of Otolaryngology at the Zucker School of Medicine at Northwell Health. The Department of Otolaryngology at this point is a very large department. We're almost 60 full-time physicians across multiple different geographic areas. All of us are involved in the training of our residents.
Our residency program has a wide range of clinical and academic experiences spread across the campuses in New York.
I think Northwell is really unique, and it's unique because it straddles this city versus suburban life. It really gives you a glimpse of the diverse population that lives here.
The residency in otolaryngology is 5 years, 1 year of general surgery followed by 4 years of otolaryngology training that's shared between the Long Island Jewish Medical Center campus and the Lenox Hill campus in Manhattan. The advantage of actually being on 2 campuses, you see 2 different patient populations.
We have a variety of rotations around the New York area, a lot of surgery going on, and also a lot of clinical experiences in the office with patients.
And to me, having that huge faculty to resident ratio is really what makes the difference.
The residency program here at Northwell Health has been an amazing experience on both campuses.
One thing that I thought was really important was I wanted to have a very diverse set of faculty who were well trained in all the subspecialties in otolaryngology.
General otolaryngology, neurotology, pediatric otolaryngology, head and neck cancer, rhinology, facial plastic surgery, laryngology.
And we have multiple faculty in each of these areas to provide mentorship.
Having a large faculty, the residents have a lot of options of finding and identifying a mentor that really is ideally suited for them. And those connections that you make in residency will go on for many, many years afterwards.
We get to start in the OR very early. As a PGY1, I get to go to the OR more often than I ever thought.
So I feel my surgical skills have really improved since I started this program.
One of the things that we have is a BioSkills training center, which is right across the street, and it's really state-of-the-art.
The BioSkills lab is amazing. It's a dissection laboratory where you can actually practice your skills with the same instrumentation you're using in the operating room on cadavers. So you get the tactile response of how that instrument feels, how it feels dissecting, how you do these things with the same equipment. It's honestly mind-blowing.
And it's a really nice experience to kind of tie off all the surgical skills that you learn in the operating room in the lab.
Probably one of the strongest assets in our program is Cohen Children's. It's the #1 children's hospital in New York.
Cohen Children's Medical Center is a unique place because it is a level 1 trauma center for children that is physically attached to Long Island Jewish. So we have pediatric operating rooms in Cohen Children's, we have adult operating rooms in LIJ, and yet you can literally walk from one OR to the other, grab a cup of coffee on your way, and be there in minutes flat.
And this is also a place where you can interact with other pediatric subspecialties, including gastroenterology and neurology, neurosurgery. Having its own intensive care unit, a pediatric intensive care unit, is also very important in learning how to manage those patients, and the neonatal intensive care unit similarly.
One of the things I think that's important when you're training in any surgical subspecialty is feeling confident when you graduate that you can manage the problems that you're going to encounter in practice.
You get graded responsibility in operating rooms, that you each time get more and more responsibility, so by the time you're graduating, you're really capable of doing the cases on your own. That graded responsibility is how you develop confidence. That graded responsibility also is in doing consults by yourself and seeing patients by yourself. There's also a very good research opportunity. At the Feinstein Institutes for Medical Research, you have the opportunity to work with a number of different research scientists there.
The quality of life as a Northwell resident for me has been great. So I get to live in Manhattan, and it's only a 20-minute commute to Lenox Hill, and I drive to LIJ, and it's also only a 20-minute commute.
You can kind of choose your lifestyle. You can be a suburban person if you want to do that, but you can also be a city person. So I think that puts it in a unique position compared to other programs.
In this program, you can have a very robust social life, but also, work really hard and have a really great, well-rounded training experience.
Otolaryngology is incredibly unique. The ability to change someone's life for the better is what keeps me going every day.
I think I have one of the best jobs in the world because not only do I get to lead my faculty, but also get to lead part of the training program here. And I have a lot of pride in training the future surgeons that will be taking care of these patients.
They're very well-rounded by the time they're done, so they really have the option of going out into the community and practicing all aspects of otolaryngology without further training. But by the same token, if they really are interested in academic pursuits and in pursuing one specialty area in greater detail, then a fellowship would be appropriate. But in either case, I think they're incredibly well-trained to really exercise either option.
It's hard to encapsulate in words the type of growth I've had because I've grown in so many different ways.
I'm starting to become proficient in the field that I have chosen to pursue for the rest of my life, so it's a really great feeling.